While authorities have ruled out some drugs played a role in Matthew Perry's sudden and heartbreaking death, it could take months to know for sure if any others did. Here's why. After Matthew Perry's untimely death at age 54 on October 28, 2023, many have been left to wonder precisely what led to such a shocking tragedy. While the official cause of death is still yet to be determined, early testing has revealed Perry had neither fentanyl nor methamphetamines in his system at the time of his demise, TMZ has reported. Additional tests are underway that will be able to uncover anything else that may have been in his system when he died, but it could take upwards of 4 to 6 months to finally get answers. Perry is well known for his time as Chandler Bing on the hit TV series Friends, and he was also open and candid about his drug addiction. He also opened up about how he viewed Friends as merely a chronicle of his substance abuse at that time in his life. He said of himself at the time,
I feel sorry for that guy. Because that's a guy that's out of control.
This has left a lot of people wondering if drugs came into play at the end of his life. So what do these initial drug reports mean, and why might Perry's cause of death not be apparent for months? While it might seem like getting a post-mortem drug test would be as simple as getting one while you're alive, it's really not the same at all. The toxicology process has many different steps and areas that must be thoroughly studied before a definite cause of death can be accurately determined. According to WebMD, blood, urine, and tissue samples are taken by the coroner during the autopsy. Dr. Barbara Jean Magnani, chairwoman of the Toxicology Resource Committee for the College of American Pathologists, explained, "We collect blood from different areas, such as the femoral vein in the leg and heart blood. The first test performed, an immunoassay, is a basic drug screening for specific opiates, amphetamines, alcohol, and barbiturates," according to Magnani. According to the International Journal of Biomedical Science, immunoassays look for specific antigens and antibodies within the urine or blood to help them find those pharmaceuticals. These tests typically require higher quantities of the drugs to get a positive reading. Later, there are additional tests with the blood and tissue that are more sensitive and can detect smaller amounts of the drug in question if it's present. WebMD noted the various forensic tests needed could take more time since some have to be sent out to specialized facilities for processing. Additionally, any initial tests coming back positive or inconclusive require new tests to be ordered. That all means finding out if drugs may have played a role in Perry's death at his Los Angeles home could leave us waiting months for more definitive answers. With over half of people 12 and over using an illicit drug at least once and more than 700,000 drug overdose deaths since 2000, according to the National Center for Drug Abuse Statistics, Matthew Perry was far from alone as he sought sobriety. It's also important to understand addiction isn't something substance abusers choose. According to the National Institute on Drug Abuse, addiction is characterized as a chronic disease, where seeking drugs is compulsive and difficult to control. Additionally, continuous drug use changes the brain chemically to challenge the abuser's self-control for drugs, which is persistent even after one stops taking them. Therefore, the want or need for drugs never truly wanes. Perry himself told the New York Times, "I've probably spent $9 million or something trying to get sober." He mentioned that he was, at the time, 18 months sober, which is no small feat. The abuse of opiates causes other issues as well. According to the National Institute on Drug Abuse Advancing Addiction Science, drug use can lead to increased risks of heart disease, stroke, cancer, and mental health issues, all of which could have theoretically played a role in Perry's death. Understanding all these different areas is vital to getting a clear cause of death for the man who was everyone's friend. If you or anyone you know needs help with addiction issues, help is available. Visit the Substance Abuse and Mental Health Services Administration website or contact SAMHSA's National Helpline at 1-800-662-HELP. That's 1-800-662-4357.